This session is being recorded and will be available on the conference platform 1 hour after the session ends. We want to hear from you in the chat. Feel free to ask questions or comment in the chat box on the conference platform. We recommend using the conference platform chat feature because that chat will be recorded with the session. Please keep yourself muted unless the presenter asks otherwise. All questions will be answered at the end of the presentation. And without further ado, I am excited to introduce Sarah Hackmeister.
Hackmeister, how do you pronounce that?
All right. Thank you, Lori. I appreciate it.
Someone was unmuted.
Okay, I think
Oh no, I just
a
said
little bit of
someone was
background
unmuted.
noise. If everyone can mute yourselves. Thank you. Okay. So as Lori said, my name is Sarah Hackmeister. I'm the Director of Advocacy at the Kansas Coalition Against Sexual and Domestic Violence. And I'm here today to talk to you about using universal education with survivors of domestic violence. So before we get started, I just want to take a moment to acknowledge the funder of this project that I am working under, which is the Maternal Anti-Violence Innovation and Sharing Project, or MAVIS. You can read the full disclosure there on this slide, but funding for this presentation is supported through the Office on Women's Health of the U.S. Department of Health and Human Services. And I'll tell you a little bit more about the MAVIS project here in just a moment. These are our learning objectives for today. This is a very quick, short presentation. And really, we're hoping that by the end of today, you'll walk away being better able to describe the dynamics of domestic violence, to be able to identify how universal education around domestic violence can be utilized by home visitors, and then also discuss some ways to safely connect those who may be survivors to local resources. A little bit about the Kansas Coalition Against Sexual and Domestic Violence, or KCSDV. We are a statewide nonprofit, and you may be more familiar with the local programs that are all throughout the state. We refer to those as our member programs. There are 25 domestic violence and sexual assault programs that are on the front lines, providing direct services to victims and survivors of sexual assault and domestic violence. So we work very closely with them. Our goal is really to support them and their work, and to support anybody who is responding to sexual assault or domestic violence or working with survivors. So we do that in a number of ways, through what we call technical assistance. Basically, anyone can call us for information, advice, to talk through any issues that they're seeing. We also do a lot of training, just like we're doing here today. We develop quite a few resources, one of which I'm going to talk about with all of you. And then we also do quite a bit of public policy work around issues that impact victims and survivors. So we have a number of specialized projects. These are not all of our projects, but most of them. And as you can see, the MAVIS project is one of those. We have a couple of others related to children and youth, and to healthcare issues, such as our sexual assault nurse examiner and sexual assault response team project. We also have a fairly new project on housing, helping get survivors connected to safe and secure housing. But yeah, we've got lots of projects that we are working on currently, and projects that we've had in the past, including a project that we had a few years ago on working with home visitors. So I don't know if any of you were around at that time and may have attended a KCSDB training for home visitors. We had a full day training that we would do, hitting a lot of the topics that we're going to talk about today. And we also created this resource. I don't know if you can see that, but it is a guidebook on home visitation, guidelines on domestic violence. So this was something we did on that project, and we still have lots of these booklets available. So I'm going to talk about that a little bit later and how you can request and access these, but we recently unearthed a few boxes of them and would love to get them into the hands of folks who are actually going to use them. So more to come on that here in just a bit. Okay. So just to kind of set the stage for how the MAVIS project got started, the Kansas Maternal Mortality Review Committee, or KMMRC, reviews all cases of maternal death in the state of Kansas. And I am part of that committee. We're looking at anyone who died during a pregnancy or within 1 year of pregnancy, or the end of the pregnancy. In reviewing the data from 2016 to 2018, it was identified that homicide was the second leading cause of maternal deaths, and that substance use disorder and or mental health contributed to more than half of all pregnancy-associated deaths. So MAVIS is really focused on those violent deaths, either homicide or suicide. I think the great news is that the KMMRC has determined that 90% of the deaths reviewed were preventable. So we are really hoping that through this project and through other initiatives and projects to be able to lower those numbers of maternal deaths and have much better outcomes. So again, just a quick kind of overview of the MAVIS project. We work very closely with the Kansas Department of Health and Environment. They were the ones who secured the funding and who oversee the project. I supervise KCSDB's work, but we actually just hired a MAVIS coordinator. Her name is Katie Wade, and I have both of our contact information at the end of the presentation if you want to reach out to either one of us. And then we also work with Kansas Connecting Communities and the Kansas Perinatal Quality Collaborative. And of course, all of our work is guided by the Kansas Maternal Mortality Review Committee and the recommendations that come out of that committee. And then I feel like I would be remiss to not just mention the racial disparities that we see in maternal health. So this information comes from the Black Mamas Matter Toolkit. We have a link at the end in our resources slide to their information if you want to find out more. But we know that the rates of death for Black women are much higher, 3 to 4 times more likely to die from pregnancy-related causes than white women. And that's because of a number of barriers that they may face, including lack of transportation, geographic issues, issues with the healthcare infrastructure, and then also potentially having providers who don't understand their needs, who are maybe dismissive or have some of that implicit bias coming in. So these are also things that we are looking at as with the Kansas Maternal Mortality Review Committee. And I just want to highlight this and then also acknowledge the important role that you all can play as home visitors, right? So there's a little bit of information there about, what we can all do to help improve those outcomes. Educating people about health risks, helping to ensure that there's adequate support from systems, and then helping people to maintain those connections with healthcare providers. Okay, so I have just a question here to get us started. If you would all like to enter some responses into the chat, that would be great. And the question is just, why is it important for home visitors to know about domestic violence? And I'll just make a note here. I'm going to be using some terms interchangeably: domestic violence, intimate partner violence, battering, pretty much talking about all of the same things when I use those terms. But why is it important for you as home visitors to know about, have some knowledge around domestic violence? Let me look at the chat here, and I'll just read through a few of the responses. Okay, I see safety, to know how to help those families going through it, to help families get the resources that they need, as part of the family wellness piece of our visits, being aware and giving support. Yes, this is a really good point. Needing to protect ourselves and get help for the people going through it. Yes, definitely. Safety, resources, knowing how to respond appropriately, the impact on children. Somebody pointing out that it's so common. Yes, absolutely. Okay, I'll have time to go through all of the responses, but I appreciate everyone sharing your thoughts, and feel free to share more as you have them. There is research that shows basically all of the things that home visitation programs are looking to help improve, right? These goals that you have of improving maternal health, pregnancy outcomes, children's development, as somebody mentioned, parenting skills. All of these are things that are negatively impacted by domestic violence. And so in order for you all to be able to meet your goals and to have these better outcomes for families, we really have to take domestic violence into account if that's happening. So I'm going to give just a brief overview of domestic violence, go through some definitions and dynamics just to make sure that we're all on the same page. And this is the definition that KCSTV typically uses in our presentations. So when we talk about domestic violence or battering, we're talking about a pattern of behavior, right? So not really a singular incident, but a pattern of abusive and coercive behavior that's used to gain dominance, power, and control over an intimate partner. So oftentimes, the tactics that are used are perfectly legal behaviors, right? Batterers don't necessarily need to use physical or sexual violence every time in order to gain and maintain that power and control. There's a number of other things that they can do, using money, using their social status, using jealousy, that can help to control their partner. And we know that battering doesn't just impact the two people, the batterer and the survivor, right? It also impacts children and other family members, potentially other people in the community as well. This definition comes from Futures Without Violence, and I will just note that Futures is kind of the go-to resource on the intersection of health and domestic violence, and they have a whole curriculum of like a full day training curriculum for home visitors on domestic violence. So a lot of their slides we have utilized from that curriculum. So if you see their logo in the corner, that's why. You know, they note that there's a very narrow legal definition of domestic violence. So if you look at the Kansas statute, it's very specific about what the crime of domestic violence entails. But when we're looking at it from a public health perspective, we're really looking at this broader range of behaviors, including emotional abuse, isolating somebody, stopping someone, intimidating them, threatening them, etc. And this is the power and control wheel. So you may be very familiar with the power and control wheel. This is sort of the go-to tool that we use to show what domestic violence looks like. So you see on the outer rim of the wheel, the physical and sexual violence kind of holding everything together. But at the very center is the issue of power and control, right? That is what abusers are looking for, what they feel entitled to in their relationship. And we see all of these different tactics that they may use in order to get that power and control. So when I work directly with victims of domestic violence, oftentimes I would have people come in and they would say, I don't know that what I'm experiencing is really domestic violence, but I just have some concerns about my relationship. Things feel kind of off or unhealthy. And so oftentimes what I would do is give them a copy of the power and control wheel and give them a highlighter and let them highlight anything that they had experienced in their relationship. And oftentimes what I would find is that, they would finish almost the entire paper would be yellow with highlighter, right? So these are very common tactics of abuse. Obviously, there are many more that cannot all be captured in a single graphic, but these are the things that we tend to see over and over again. Using economic abuse, that is true of something like 97% of relationships where there's domestic violence, there's some sort of financial or economic abuse present. Also using children, very common. Abusers may threaten to take the children away, they may threaten to harm the children, they may undermine their partner's parenting. And so that is, for couples that have children, a very effective tool and tactic of abuse. So you may have seen this statistic. This comes from the NISFA survey, or the National Intimate Partner and Sexual Violence Survey from the CDC. But we find that this number is pretty consistent across multiple surveys, that 1 in 4 women have experienced physical violence by an intimate partner in their lifetime. So as somebody pointed out earlier, this is very common, impacting a lot of people. And just a quick note, anyone can be a victim of domestic violence. It cuts across all races, sexual orientation, religion, ages, socioeconomic levels, but certainly there are factors that can increase people's vulnerability to violence and really reduce their ability to seek safety or to get out of that relationship, right? So if someone doesn't speak English, or they're undocumented, or they have a disability, right, that can really limit their ability to get away from their abuser, to be believed, to receive outside help and support.
Sarah,
Yeah.
we have a question. The slide prior to the one that we had just seen, can it be found in Spanish?
The power and control wheel?
Yes.
Yes. I'm about 95% sure there's a version in Spanish. There's lots and lots of wheels out there. There's wheels on same-sex relationships, wheels on adolescent relationships. So yes, I believe that there is one in Spanish. And you can probably find it on our website.
Jackie answered and said there's a Spanish version on futurewithoutviolence.org.
Okay, great.
Thank you, Jackie.
Yes, thank you. Okay. So we also know from some research that was done in 2008 that quite a few people who receive home visitor services have experienced domestic violence within the past year. So there's this range of somewhere between 14% and 52% of home visited perinatal clients So very likely that you are coming into contact with some folks who have experienced domestic violence in your work. So we're going to do another chat question here. If you want to jump in with some responses to this, why might a survivor stay in a relationship when domestic violence has occurred? And I think this is the number one thing that I hear when talking about domestic violence. People say, well, why don't they just leave if things are so bad? You know, why would they stay in that situation or that relationship? Okay, so I'm just going to read through. Nowhere else to go. They could be scared to leave, fear of losing their kids, fear of being alone. They're told that no one else will love them or want them. They think that their partner might change. Fear of not being able to make it on their own, may feel safer to stay. Scared for their life, no support system, finances. Yes, absolutely. You guys are all right on target here with your responses. Lots and lots of reasons that survivors may choose to stay in their relationship or with their partner. And we know that oftentimes when you look at the risks of staying with a batterer or the risks of leaving, right, those risks are oftentimes the same. There's a risk of continued or escalating physical violence if someone stays with their partner, but also risk of escalating violence if they leave their partner. You're risking, potentially risking children's safety and security if staying, also if leaving. Financial risks, legal risks, risks to family, friends, other people in your social circles. So it really is something that survivors have to weigh and have to make their own decisions about what is going to be best and safest for them, right? And they're the ones who have to live with those risks, and they're the ones that know their situations best. And I also just want to flag really quickly this issue of separation violence, which I think some people touched on in their response, that oftentimes that is the most dangerous time for survivors, the time that they're most likely to be killed when they're attempting to leave or right after they have left. So there's some data there as well. So again, if you think about that power and control, leaving is a time that batterers are going to feel that they have lost that power and control, and they're going to be motivated to do something maybe more drastic to get it back. Okay, so let's talk about where all of you come in, kind of this intersection of domestic violence and home visitation. Again, this information is from Futures Without Violence, but they identified some reasons that professionals and home visitors may have difficulty identifying and addressing domestic violence. So this can be a really uncomfortable thing to talk to people about. It's a very personal thing. Sometimes people feel frustrated when survivors don't follow up with a plan that they've made, or they may do something that seems counterintuitive or seems like a bad idea to someone who isn't in that situation. So that can be very frustrating. Also very important that home visitors or anyone receiving a disclosure knows how to respond effectively in that instance. You know, if you're not quite sure how you would handle that, that's going to be very overwhelming and difficult to navigate. We know that all of you are very busy, that there's not a lot of time that you have in order to address everything that you want to address. And so that can definitely be a factor as well. And then there's also this issue of involvement of Child Protective Services, or in Kansas, that would be DCF, or fear of deportation for folks who are undocumented. And I think that is, from the survivor's perspective, probably the number one reason that they don't share that they're being victimized is fear of having involvement from other systems, and definitely fear of having their children removed from their home. So this information comes from a survey that was done and kind of with the National Domestic Violence Hotline, where they talk to survivors of domestic violence about mandated reporting or when reports were made to Child Protective Services. They found that 50% of those survivors said that it made the situation much worse to have that report made. 12% said that it made the situation a little worse, and 20% said it didn't make any difference. And there's also a couple of quotes from survivors. One person said, "I did not want to share any information because I was afraid if the police or anyone else came to the house to ask about the abuse, I would be killed afterwards." So I think that's really important to keep in mind, especially as we talked earlier about some of the racial disparities in maternal mortality, right? That different communities are impacted differently by systems involvement, and may have much more fear around police involvement or child protection services involvement, and for good reason. So just something to keep in mind. Okay. So I think most of this we have talked about already, but I think you all doing this work in people's homes may have access to survivors who don't have access to other outside resources, and you have a really unique opportunity to observe some of those dynamics in the home and see some of those red flags that may pop up. Okay, so I want to talk about the CUES intervention, which is a universal education intervention that the MAVIS project is really doing a lot of training on for healthcare providers and other people who come into contact with people who are potentially experiencing domestic violence. If you are already doing domestic violence screening as part of your assessments that you're doing with folks, it's a really good idea to do that universal education before doing that screening. I'm just gonna check the chat. Okay, let's doesn't look like we have anything new. All right, so I'm going to show you these cards. They're the cards pictured on the slide there called Healthy Moms, Happy Babies. And again, these come from Futures Without Violence. They're these little safety cards that they've developed. They have several that may be appropriate for this population based on the needs. This one is available in English and also in Spanish, which is great. And most of their resources are available in multiple languages. So I do have a slide kind of later on that talks about some of the different resources they have available, and then also how you can get access to those. So before we jump into CUES, I'm just going to consider some questions that home visitors have used in the past when trying to do a domestic violence assessment. So again, if you can use the chat to respond, we're just going to go through each one of these. Well, maybe we'll do the first two together. So a home visitor says to a client, "No one is hurting you, right?" Or "You aren't being abused, are you?" What do you think is the problem with those questions, and what kind of response do you think you're going to get from somebody if you ask those questions? And again, you can just put your responses in the chat. Okay, so somebody said they're closed-ended, they're leading, you're basically answering for them, they're judgmental. It sounds like you're already assuming something, right? Mom may not realize she's being abused. Sounds judgmental, not going to get the truth. Yeah, absolutely. Yeah, so this is really kind of putting the answer into the question, right? No one's really going to feel comfortable saying, oh, well, actually, I am being hurt or I am being abused. And as somebody pointed out, people may not know what being abused, what you're asking about there. Okay, what about questions 3 and 4? What are the problems with these questions? Have you been experiencing any domestic violence, or are you being abused by your partner? Okay, vague, may not know everything domestic violence consists of, terminology issues, also leading questions. Abuse has different meanings, not just physical, speculative. Yeah, so definitely. The term abuse or domestic violence both can be very stigmatizing. And somebody who's in a relationship where they're being controlled may not necessarily think that those terms apply to them, right? Remember, I told you I worked with a lot of survivors who came in and they said, I don't really know if what I'm experiencing is domestic violence, right? There's kind of a fear of attaching that label to the situation, but they knew that there was something wrong with their relationship and they wanted to talk to somebody about it. Okay. What about question number 5? Are you safe in your home? What do you think about that question? Or what might be the problem with that question? Okay, yes, absolutely. Very broad, right? So safety in the home could be asking about a lot of different things. It could be, do you have smoke detectors in your home? Is there community violence? Do you have loose railings in your home that could be safety hazards, right? So are you safe in your home is not a specific enough question to get at what we're looking for. Okay, great. Okay, yeah, and someone also pointing out that past trauma could make them feel unsafe anywhere. Absolutely. Okay, so this kind of leads me into why we like universal education so much. There is a lot of data. The CUES intervention is an evidence-based intervention, and they've found that people exposed to the universal education curriculum feel much more confident talking to others about domestic violence. And then also patients or clients receiving the CUES intervention have more positive feedback. And they're also really likely to share that information with their peers. So this study found that people who received the universal education were almost twice as likely to share a domestic violence hotline number with someone. And that's great. You know, we want to help survivors, but we also want to help communities to help each other get access to these resources. Okay, one other thing I'll just say about the CUES model or universal education is that we're not necessarily looking for a disclosure, right? We're just giving the information. We're giving the same information to everybody so that everybody has the information. and then they can decide what to do with the information. So that is also something that may make people feel much more safe and comfortable, knowing that they're not pressured to make a disclosure, or if they are experiencing violence and they don't feel safe talking to someone about it, that they don't have to lie in that moment, right? The goal is not to make a disclosure. But we do know that disclosures may happen. So we want to be really careful and take some safety precautions before we're even broaching this topic. Having these conversations always needs to be done in a private location. So without the partner present, for sure, without older children who may overhear. This is something that you really only want to do if you are able to do it in a place that is private and there can be some confidentiality. And then, we always tell people, hey, I'm going to give you these 2 cards. But if there is domestic violence happening, it may not be safe for somebody to have this information lying around where their abuser could see it. And so I always want to check in and make sure that it's okay to leave the cards with the client as well. Okay. All right, I'm going to go through the cues model and just give you kind of a quick overview of what this might look like. So the C is obviously for confidentiality. And again, we want to make sure that we see that client alone, and also that we disclose any limits of confidentiality that we have. So if you are a mandated reporter, having that conversation up front about what your obligation may be if there's disclosure of harm to a child, that allows the person to make an educated decision about whether or not they want to talk to you. I will say that our domestic violence and sexual assault programs, advocates are not mandated reporters, generally speaking, unless they have some sort of licensure included in the mandated reporting statute. So they are a place that survivors can go for confidential services without fear of a report being made. So making sure that all of that information is provided up front, and then moving into the universal education and empowerment portion. So there's also a script or a video on YouTube. If you just search for Futures Without Violence Home Visitor, it will show you kind of a vignette of a home visitor walking through the card with a client. And there's a couple of options here for language that you can use, sort of a script. The language in the video is a little bit different. So I think the best thing to do is kind of find the language that works well for you and flows a little bit more naturally. So you could say something like, I've started giving 2 of these cards to all the moms that I work with, because we know that relationships are complicated and they can change. And I'm going to give you 2 of them so you have information on how to help a friend or family member if that comes up at some point in the future. Another thing you could say is something like, so many of the moms that we work with are struggling in their relationships, and we've started talking to everybody about their partners and how they're being treated. So that kind of sets the stage, also normalizes that unhealthy relationships or abuse is very common, that they're not alone in that experience. And then moving into opening the card and doing sort of a quick overview. And Lori, I see you have unmuted. Do you have a question?
Yes, Susie Green asked, how do you do universal education for both partners? Or how does one identifying one client out of a partnership?
Mm-hmm. Yeah, I think for the cues model, the recommendation is to do it for the female partner if it is a if it's a, heterosexual couple. And then there is some information in the home visitation guidelines, kind of like working with both parents that may provide a little bit more context on that. But that's a really good question. Yes, and I think I'm not sure as far as same-sex couples what the recommendation is there. I could certainly do some additional research and find out, because that's a really good question. Some of that may be kind of looking for those red flags, like if one of the partners seems like they're a little more controlling, if there's some things that strike you as being concerning, you may want to have a conversation with a partner who's not exhibiting those controlling behaviors or those red flags, and provide that information. But I will say, I think most of Future's materials, maybe not all of them, but a lot of them are, like, the title of the card is Healthy Moms, Happy Babies. So I think they, a lot of the materials are targeted more towards women and moms. So you might think about that, think if there's a different card or resource that may be better. I'm looking at, they have another one called Safe Home, Safe Babies, but it also talks about moms. So great question. I will definitely do some more research on that. Okay. So yeah, then you can open up the card and just kind of go through it briefly. Say something like, there's a little quiz in here. It's kind of like a magazine quiz that talks about healthy and safe relationships, and also relationships that may not be safe and healthy, and how those can affect your health, your pregnancy, and then also your parenting. And then there's also some connections to other things you may not think about, like depression and substance use, and how those are oftentimes connected to hard relationships. So again, the language that is being used is not domestic violence, it's not abuse, right? It's hard relationships, healthy relationships, unhealthy relationships, complicated relationships, right? More of the terms that people often use in describing their own situations that are a little less stigmatizing. Then on the for the S, under support, you want to point out the safety plan on the back of the card, and then also information that they can reach out to. So there's a 24/7 text and hotline where people can get connected to somebody who has a lot of experience helping people in complicated relationships. And then you can also offer, you can also talk to me about any issues or questions that you may have. So that's kind of the cues in a nutshell. And again, we're not necessarily looking for a disclosure of abuse. We're making sure that everybody has the information, that they have just some, very basic information about how violence may be impacting their health and their parenting and their children. And then what they choose to do with that information is their decision. So I do want to talk about responding to disclosures, since it is quite likely that a disclosure may happen. So the first thing is to definitely validate that client's experience. And we're going to talk about some things that you can say in order to validate them here on the next slide. Again, offering the safety card if it's safe for them to do that. So if they make a disclosure, I would for sure ask about, okay, is it safe for me to leave this information here with you? Do we need to talk about safety planning around that, right? So I think the good thing about these cards is that they're very small. So, they can maybe be tucked into a shoe or a sock, somewhere that the survivor could keep them where they aren't going to be found by their partner. But again, that's a conversation that you would want to have. You are going to want to discuss some different options that the survivor has. Contacting an advocacy organization is definitely one of those. You want to do kind of that an immediate safety check. Do you have any immediate safety concerns? Talk about some different options, and then help them get connected to a domestic violence advocate, which we're going to talk about next time. If they want to, they may not be ready for that step. They may have some reason that they don't want to talk to an advocate. Again, that's fine, and that's their choice. But you do want to follow up at the next visit as well. So a few things that you may want to say if you do receive that disclosure. I'm so sorry that this is happening. You don't deserve this. Assuring people that it's not their fault. And then also, I think it can be really helpful just to convey, that you're worried about that person and their safety, and also the safety of their children. Okay. So that is kind of the cues process. We're going to get into talking about connecting people to domestic violence advocacy organizations here in just a moment. But I did want to just give you the link to the various safety cards and let you know what is available. All of these are on the Futures Without Violence website. You can order them for free. You can also download a PDF. So if you were kind of in a pinch and needed to just print one off and fold it up and give it to somebody that way, you can do that. They're available in multiple languages, Spanish for sure, and some additional languages as well, which is great. And then they have some really kind of specific populations that they have cards for, and then some specific situations. So like there's a card for campus health, there's a card specifically around reproductive and sexual health. And then, yes, I forgot that this was on there, but for the person who had the question earlier about same-sex relationships, that may be a time where it's more appropriate to use one of their cards developed for that population. I added this picture of the card, the Young Moms Strong Kids card down on the bottom, because that is a resource that is specific to adolescent moms. And it's one of their newer cards. And I think it's a really great resource. So there's lots of things available on their website that you can go check out. It's all free. You just have to pay $15 to have it shipped to you. Okay. So with our about 10 minutes remaining, I want to make sure we all know a little bit more about domestic violence advocacy programs, what they can do for survivors, and how to get connected with them. So I think oftentimes when people think of domestic violence programs, they may just think of shelter. There are many other services that our programs provide. So one thing that's important to know is that all of the services are free. None of our programs can charge anything for any of their services. All of the services are voluntary. We do not force anybody to do anything that they do not want to do. and they're all confidential, as I said before. We have very, very strict confidentiality laws, very limited instances in which any information about a survivor could be released without that survivor's permission. So our programs have 24-hour-a-day crisis hotlines that people can call anytime, even if they just need some emotional support, they want to talk to somebody, any time of day, that is always available to them. We do what we call personal advocacy, where an advocate can accompany somebody to a medical appointment or exam, accompany them to court, to meet with law enforcement. We have shelter, obviously, but then also emergency accommodations, like if somebody needed to be put up in a hotel for a couple of nights for some reason. That was a service that we utilized a lot more during the height of the pandemic, when there were some additional safety concerns with congregate living. We also have support groups, supportive counseling, services specific to children and youth, and then our programs obviously also do a lot of community awareness and education. This is our program map, and you can see where all of the various programs are located. I will say probably the best way to get connected to a program, well, one, you want to find out, what the program is in your area, but we do have some kind of shifts in the map from time to time. So a program that was covering a specific county, another program may take that county over for some reason. So probably the best thing to do is to go to kcsdb.org. I have a link at the end of the presentation where you can go directly to the map, click on it, click on the area where the person needs services, and it will pull up that program directly. Or you can always call the Kansas Crisis Hotline. The number is listed there, and they will get you connected to the program in your area. Lori, do you have another question?
Yes, Gretchen asked if someone has a felony, can they access the resources from the last slide?
Yes. Yes, our services are available to everyone. We do not discriminate on any basis, including criminal background or any sort of conviction. Good question. Okay. So maybe just some questions to ask yourselves. Do you have a working relationship with your local domestic violence program? If not, why not? And then what are some of the ways that we can improve referrals for survivors? Anybody want to jump in the chat and share anything around that? Anybody have a really good working relationship with your local DV program? Anything that you've done that you found to be effective? Or any ideas that you have around improving referrals for survivors? I'll give you just a minute there if anybody wants to chat something in. Okay. Susie said partnering with a court advocate has been very helpful to do outreach to some of our clients and help them determine next steps. Okay. Moxa is a program that I've called multiple times, and they have been an amazing resource every single time. Okay, great. Excellent. Okay, well, feel free to keep chatting in some responses or some experiences that you have working with programs. And maybe those will stimulate some thoughts or ideas for moving forward. Just want to give you a couple of like referral best practices, right? So I think survivors are going to be much more likely to reach out to a program if they receive a warm referral. So this is what a warm referral looks like. It may be making that call together. Again, we're not pressuring anybody to make any calls or contact anybody, but giving that option, I think, is really nice. If not, having the name of an advocate or a point of contact that they can call. You know, I have certainly found that when I tell somebody, hey, you should call Julie at such and such program. I've worked with her in the past. She's really knowledgeable and helpful. People are much more likely to reach out to that person because you trust them, right? And they've already established some rapport with you. So making the call together or giving a specific name of somebody that they can contact is also a good idea. Having some familiarity with the services and how they can be helpful is also really good. Being able to speak to the quality of the services. So as somebody mentioned in the chat, being able to say, you know, we've had advocates that provided court advocacy, and it's been really helpful to other people that I work with, is a really nice option. And is going to get much better results than just making a cold referral where you're just handing somebody a phone number, not really knowing anything about who works there, what exactly they do, or the quality of the services. Okay. All right. So we have just a couple minutes left. I promised we would come back to the home visitation guidelines on domestic violence. Again, we have lots of these available in our office, and I'll put my contact information up or Katie's contact information. If you want to get some of these, feel free to request a bunch to share with your coworkers. I did list just the table of contents. You can see a little bit more about what is in there. I will note that we don't really talk about universal education in this guidebook. That is something that we have really just started working on in the past year or two. But we do talk about screening for domestic violence, and I think there's a lot of good and helpful information around that, also around home visitor safety and self-care and safety planning and all of that good stuff. Okay. And then I just wanted to highlight this quote that I think is really important. From Bancroft and Silverman, the emotional recovery of children who've been exposed to domestic violence appears to depend on the quality of their relationship with a non-battering parent more than any other single factor. I cannot stress enough how much the safety of children is connected to the safety of the non-offending caregiver, and how important that connection is. And so we want survivors to be safe and kids to be safe, and doing that together is the best way to go about that. Okay, here's our resource list. The Black Mamas Matter toolkit. There's a link to Futures Without Violence. And again, the Healthy Moms, Happy Babies card is available there, along with a lot of the other safety cards that we talked about. There's KCSDV's website and where to find your local program. And then I'll just end here with my contact information. There's my email address, and then also Katie Wade, who is our new Mavis project coordinator. Either one of us will be able to get you the guidebooks, give you additional information, talk through any issues that you're having, and or support you in any way that we can. So I think we are right at time, but I really appreciate being here with all of you and being able to provide this information, and keep up the good work. We know that the work that you do is invaluable, especially for survivors of domestic violence.
Thank you, Sarah, for a great presentation. Please hop on to the platform for the next breakout sessions. They will be happening at 3 o'clock. We look forward to seeing everyone there. Thank you again, Sarah. It was a wonderful presentation.
All right, thank you. All right, Lori, is there anything else that I need to do?
No, we are finished. I'm going to stop the recording.
Okay.